looking to chat with people because we would love to use like video and audio recordings of people for a training about writer comfort with sort of delivering bad news to the family in anticipation that moving forward, there are going to be more deaths and there are going to be less resources. So kind of getting this right is sort of more important than ever, but it's also, I think, more difficult than ever.
Please remember me happily by the rose bush, laughing with bruises on my...
Let's start on the first one, which is, how do you find meaning in death notification, and how has it become sort of an important part of your job?
That death notification, it's one of the hardest parts of the job. The way that I find meaning in it is it's the opportunity to be the best part of somebody's worst day. And that's really how I describe it, is this is a day that they're going to remember for the rest of their lives. And what we need to be is, at least, if not a good memory of it, at least they will remember that we cared and that we were there for them. And I think that knowing that you are easing somebody's hurt in such a terrible situation is something that you can take away. And even if we are unsuccessful in resuscitating somebody, we can at least say, you know what, I made that person's loss a little bit easier to deal with. So it really is making a difference every bit as much as a successful resuscitation is, just in a vastly different arena and method.
It's about sort of taking care of other human beings. And I think connecting with other human beings and sort of doing the right things for people, we focus on doing that in life and in saving their life, but it's more than that. It's about doing it when it comes time for death, which is just part of the same continuum.
I do find it a privilege to be able to speak to someone in this moment. Being able to have those conversations with people is really, really important, as uncomfortable as it may be for some people. The more you do it, the better it will be, and it does, I don't want to say you get used to it, but you do in a way, and you just get used to comforting people in a way and bringing them like a solace in this moment that's usually really, really hard. But, I think we should take pride in the fact that we can be there for people in that moment and really look at it as more as like a privilege, and that, you're able to be with them during this really difficult time in their life. And they'll always remember that.
If someone said that this conversation is a paramedic level skill, what would you say to that person?
I really think it's an anybody level skill.
I struggled to do it and floundered to do it without realizing that it was a skill that I had to prepare for.
I think conversations are a procedure, just like everything else that we do, where that there's certain ways that we approach it, and everybody has a little bit of a different style that sort of fits them and their individual skills. But I think it's sort of one of the most critically important things that we do. The procedural aspect is actually really important, because I think if you approach it with a framework and you have sort of the words that we're used to saying, right? Like, no two situations are exactly alike, but it makes it so that you have a way to dive in and approach it. Just like before you set up to do anything, you have, you set out all your gear in a certain way, and that sets you up for success. Having a framework of how you're going to approach it is something that's going to set you up for success in a situation where it's sort of easy to doubt yourself or feel uncomfortable.
Are there things that you do before this moment that you do to prepare to have that talk?
My first question is usually to establish the baseline. Can you tell me what you understand can you tell me what your understanding is of what's gone on so far? Or what do you know about what's happening in the other rooms? So kind of doing a little fact-finding mission is really helpful, because we can't make any sort of assumptions about patient literacy or family understanding. I've had patients where the care provider is a retired physician. So clearly I'm going to speak to that person differently than I'm going to speak to someone that doesn't have any command of medical language at all.
You know, no death is ever really expected, you know, and a lot of times we're like, oh, it was an expected death. And, you know, no one went to bed that night and was like, oh, Monday morning, and, you know, grandma's going to die. Like, no one ever thinks that way. So it's really important to remember that and just take that approach, because this is the first point for them really that their whole life is really going to change.
How do you feel about family members being there for the resuscitation?
We actually moved from not having family members around for resuscitation into having family members present for resuscitation. When I'm on scene with a resuscitation, as long as the family is not in the way and creating so much stress for my team, I will always have them in the room if I can. And that's in the emergency department, or frankly, in somebody's living room or kitchen. It's their space, and allowing them a safe access to be able to witness what we are doing gives them a better understanding for exactly what's going on.
And then I'll ask, you know, who is here in the house today? Who's the main support person or caregiver? Who else is here? We need to have a discussion, and I want to know who is the best person to be the spokesperson for the family and who else should be involved in the chat. Typically I try to take them into a different room, but not so far away, so they can actually pop in and see what's going on, or they can hear what's going on. There's a lot of discussion in medicine about whether family members should be witness to resuscitation. I really believe that they should. Certainly there's people that can't handle it, but I think the vast majority of people probably can. And I think that they should be given that choice for themselves. Years ago, we made it for them. You know, the family went to the special room, and some people don't want to see, but I think the vast majority really do.
Describe to me your approach. So you're on scene and you need to deliver the news. How do you go about doing that?
On any call where, you know, death is a possible but also likely outcome, it's the first time we're talking to the family should not be when we're about to make that decision or when we've made that determination, really. It should happen a lot prior to that. Starting off, really, a lot of times they don't even know what's going on. You know, a lot of times people will call 911 and they don't know that their loved one's dead. You know, they found grandma, she was not waking up this morning, they called 911. And the 911 operator told them to push on their chest and give them CPR instructions. And they really have no idea, you know, that, oh, they're actually, you know, clinically they are dead, you know, and you shouldn't sugarcoat it, I guess, is the first thing I say. Like, you know, I start off, I introduce myself. This is my name. This is who's working on them. This is what we're doing to help them right now. This is what's going on, and try and explain it in, you know, as simple terms as possible. Always ask too, like how you can support them. A lot of times we forget this, and that they might need things that they need support for. I know I was on a call where I asked that question, like, how can I support you? And the woman, she's like, oh, my son who's sitting here, he, you know, I hadn't really noticed him in the background, but he was about my age and he was severely autistic. And she goes, can you just guys be like quiet when you walk in? Like, that's all I'm asking. And I was like, absolutely, like we can do that. But it was something that like I would never have thought of, I guess, prior.
I think an excellent method to approach this with is make sure that you are communicating right along with the family, which means from the outset, and obviously this is going to be affected by the number of resources that we have on a scene, but somebody at the outset should be speaking with the family and describing what is happening and what is being done. and at the same time, at least starting to broach the subject of the prognosis of the situation. There are many arrests that we walk in, and we know from the outset that the possibility of a successful recovery is very low. And I think it's important that we start to broach that subject with the family early so that they have time to digest that, so that when we reach a later point in the resuscitation where we are preparing to terminate, they've already been prepared for the prospect of that, so that when we reach the point of termination, we can say to them, we have done everything that possibly could have been done here. There is nothing more that a hospital would do for this patient or anyone else. We did everything that we could, and I'm sorry, but they have died. And I think that's if you kind of build up to that, it's less of a shock when we get there.
First thing I do when I'm on scene with a family, there's a resuscitation ongoing, is to keep them posted as to exactly what we're doing during the process of that resuscitation. Because if they know what we're doing, they know the effort that we're expending, and they know the process of care that their loved one is getting, it's much easier when ultimately we say, we've done everything that we can and we're done. So the first thing I do is explain everything that's going on. And when I do that, in what I really think is the most important component of all of this, I do it in English with empathy. You can't speak medicine to people in crisis, even if they're medical people. Speak just like a normal human being. Refer to the loved one, the person that's on the ground there, the person you're working on, by name. Talk about what's happening. Their heart has stopped. They're not breathing. And then ultimately, when we're done, use words like dead. Mr. Smith died, and there was nothing that we could do to get his heart started and his breathing again, and getting him breathing again.
So my Uncle Mike, retired state trooper, and I've been around when he's had to deliver bad news to people that we loved, and I kind of do a combination of Uncle Mike and then I think about what I tell trainees in this moment too, and it's always stand up tall, take a deep breath, and then I kind of harness my Uncle Mike, and I tell somebody, I'm sorry, I have some very bad news. Would you like to sit down? And then when they're sitting and I'm sitting, I say, listen, and you don't want to drag this out. This is the shittiest moment of their life, right? This is somebody that they love that they're never going to be able to be around again. So I try to deliver it real fast, but there's a part of me that just can't take it, and I always blunt it with something else. I say, I'm very sorry to have to tell you this. Your husband, your wife has passed. She has died, and there's nothing more that we can do. And then I pause because, you never want to steamroll somebody. They have an emotion to express or anything to ask, right? So I pause and wait, and if they don't say anything, I'll kind of move my hands a little closer and say, is there anything I can do for you? Or is there anybody that we can call to help you through this?
If you come in and you don't have the time, you don't have 25 minutes of resuscitation to set up what's going to happen to the family. What if you walk in and they are clearly dead, but the family doesn't realize it yet?
If you walk in and they are clearly dead, I think that we simply start that much earlier. We say that I'm sorry, but they've died, and there's nothing further that we're going to be able to do for them. And then immediately turn to, what can I do to help you? What can we do to ease your pain right now? Can I call somebody for you? Would you like to see them, right? We can start preparing within the rules that we have to follow. We obviously have to consult with the appropriate police agencies who may be on scene about moving or disturbing any scenes of potential evidence. But in an uncomplicated arrest, I think that we can prepare the body for viewing by the family. We can clean them up if they've been incontinent or vomited. If they don't have clothes on, we can cover them with a blanket while leaving their face exposed. We can make it presentable to the family and really kind of turn our efforts towards that most important part of easing their loss.
Sort of thinking back on your experiences, has there been a time where this has really like hit you as like this is an important skill to have?
You know, it's funny. It took me a good 3 years before I could even say the word dead. I know we went through class and they made it so vital that you start the healing process by using that word, and I just couldn't do it for so long. Just using that word was really, really hard, and it did. I'm sure I did no help to my patients at the time. All the studies and everything. I really wasn't. I knew them, but it didn't. It wasn't. I don't know. I was a sissy, I guess. It takes a real set of fortitude to tell somebody that a loved one died.
Actually, my last person who we pronounced in the field was someone who I had taken a bunch of times before. He was a medically challenging, complex patient. And every single call that I've taken there, I remember because I had learned so much. And his wife helped to take care of him. And she became so medically savvy throughout all of this that it was great because I could ask her questions about his devices and things, and we had a good working relationship. And I was actually wondering how they were doing recently because I hadn't heard from them in a while, and it turns out they weren't doing well. And when we went to their home, it was because they'd figured he'd passed away, and I didn't realize that he'd been going on hospice. So the family had been preparing. However, when we got there, we had to have masks and goggles and gloves this time. Normally this is someone who his wife who I've hugged her before. I go in their house, I look at their pictures from vacation, I know the name of their dog. That's sort of the level where I knew this family, and I think it was more of a surprise to me that he passed away than to them. But at the same time, when I delivered the news, I don't know if maybe I was feeling more feelings about it than usual, but they were like, is he dead? Because they didn't want to take his ventilator off if he wasn't. She said, I promised him I wouldn't let him suffocate. So I was like, I'll show you on the cardiac monitor, there's no heartbeat. And I was trying to explain to her, his heart's not beating, but for some reason I couldn't say the word dead. And I usually almost always say it. And it always goes over well. And maybe I just took it for granted. But this one time that I chose not to say the word dead, it almost caused her more distress because she kept asking me. She's like, but does that mean there's no hope? Does that can we do something? He's DNR DNI, but is there something we could give him? And to kind of keep it sort of drew out the process with the misunderstanding. And that was such an important moment that I wish I could have done better for them. Because their family was really important to me. Afterwards, you've told them the news, they've had a chance to respond. What do you do between that time and the time that your ambulance pulls away from the scene? What's important to you there?
I think that you kind of need to be looking at that person, assessing them, being with them, making sure that they're okay. I just feel like there's this human connection aspect of it where it's not okay, we're not painters who just came in and painted a wall. This is a life-changing experience for them. So, kind of make sure that you're tending to their needs is definitely something that I feel like is great importance. I think that cleaning up the scene is a pretty considerable thing to do. Not leaving wrappers and crap all over the place. I mean, cleaning up to the best of your ability. You definitely don't want that person in there picking up wrappers and stuff from, supplies that you use during the code. I just feel like that's not being sensitive to them.
Try to clean up as much as we can. The presence of EMS in the house and the resuscitation, as we all know, generates a lot of trash, a lot of mess. We may have rearranged the furniture and completely disrupted the household. And as much as we can do to restore that household to an orderly setting for the family to then be able to spend some time with their loved one's body, I think that that's key. So we pick up our trash. If we've spilled stuff, we pick that up. We put furniture back where it belongs. Same with the body. We may be required to leave things such as endotracheal tubes in place. And if that's the case, we need to prepare the family for that. Say, all right, you can go in and see them. Understand that we put a tube down their throat in an attempt to help their breathing, and that is still there, and we have to leave that there. So that's what you're going to see in their mouth. Prepare them as much as we can for what they are likely to encounter. So really, those are the two big things: is clean up and prepare the family for what they're going to encounter.
This last time, the questions were primarily centered on, so what happens next, like who comes in next?
Like that what happens next question is like so universal. And I don't know how prepared you feel to answer that. I don't think I feel super prepared to answer that question.
I always feel like I'm kind of turfing that question. We try to like collaborate between the services. So then I'm like, this is the officer. He'll be kind of able to answer a lot more of those questions. And that way I'm not misinforming them either. But I always feel uncomfortable with the inability to provide more information on that. So
sure that they understand what's going to happen. The process afterwards, a lot of times within home deaths, the ME will come. There's a process where they're like, do I call a funeral home? What do I do? Even if they're in hospice care, a lot of people aren't sure what to do. Some people think that the ambulance is going to take their loved one's body away. And, they honestly are not sure of the process. So just being able to explain the process to them and understanding the steps. Usually that's where the sheriff will step in and assist with that as well. But being able to explain those steps to them, I think is really key. And just from that point on, after, offering condolences and that and explaining the process, I asked them, is there anything else I can do for you? Is there any other way I can support you? Is there anyone you'd like me to call? Usually there is someone that they want to call. I would say about 90% of the time there's someone they're like, oh my gosh, could you actually call this person? Because I don't know how to do that. So that's also something that, I've taken on the role on, at least on multiple calls. And from there, I'll usually hand it over to the sheriffs and then we head out.
The other thing, she was like falling apart at the side of the bed and like I couldn't hug her. Like I couldn't come within 6 feet of her. Probably. It goes against all of your instincts and everything that like we've trained to like be compassionate human beings about, to do it this new way. And that's going to be different. I'll give like a hug or like I'll hold their hand when I deliver the news, but like that's getting tougher and tougher with all of this new stuff. And like, have you had to deliver the news wearing a mask yet?
No, not yet. I don't know. Would I? I don't know. That's a tough one. But we have to, don't we? I never even thought about it. Shit.
We just leveled up.
Oh. end up hiding so much of your face, and all the warmth that you could express with a friendly smile is gone. I don't know. All you left is your eyes. I don't know.
What do you think would be like the most important thing that you would tell someone to do this successfully?
They probably won't remember all your names. They're probably not going to remember everything you said, but they'll definitely remember how you made them feel. And in that moment of, really great distress for them, they found comfort in that they knew what was going on and they were aware of the process and they felt supported. And I think that's a really key thing to make the family members feel, is that they are supported, because they are.
I don't know. Listen, so if I could go back and tell myself after I graduated paramedic school, knowing that this was going to happen, what would my advice to me be? It would be, get a set of stones. You got to do it, man. It's not a good part of the job, but you got to do it. I think just deliver the message to somebody as if it was a good friend.
I think a lot of it is kind of have a plan and a strategy, maintain professionalism in that will secure confidence in the family. So if you're able to kind of strategically point out, like, this is what I did, this is where we went, this is what we're capable of, and this is really what's going on. Family members, especially in the face of grief, aren't able to make the decision, even if they're well educated. So they don't always need do you want us to, more of, is that okay? Like, this is what we're going to do, and kind of taking lead on this, because that's why we aren't able to treat our family members, as our minds kind of go in different directions at that point. So I think being a sense of competence there, but I think sometimes people confuse that with it's okay to be sad, and it's okay to be sad along with them. And I think in the right situation, like, it's certainly okay to express that. You don't have to be cold or sterile. And I think each situation is going to be different, and just kind of being true to yourself and who you are as a person and how you would handle that, I think, is okay. So I know I've heard debates before about, was it okay to hug them? Like, should you cry? Like, that sort of thing. And I think it's really, it's you, like, is that natural for you? And I think there's some people that if they cried in the middle of a scene, like, it would be largely inappropriate. And there's other people that shedding a tear with the family feels even more at peace than ever, because they felt like their provider really cared. But I think it's those same people that would come to calling hours of someone that they didn't really know, and would they, the reaction that you would have there. So if you think about, the most natural, like, if this was your friend sitting there, how would you approach this? But also maintaining like that professional, like, almost structure to how you approach it, I think is the best advice I have, because each one is going to be different, and you're never going to be fully prepared for the next one, and that's okay. That's why we do emergency medicine, right?
I would say the most important thing is to understand that this is a moment for that person that you're going to tell this to, that they will never, ever forget. And you want to do it in a way that is effective and clear, because I don't want to draw out that part of it. And if we're gonna do something unpleasant, I want to make sure that we do it as quickly and efficiently as possible, and then be prepared to comfort them and to help guide them through the next step of, they're like guaranteed they're going to ask you, what do I do next? Like, think about that ahead of time.
Some people take death differently than others. Any effort that you could make to make that situation as smooth and cohesive as possible, I think that you need to bring that. I think that that's just a hard situation, regardless of who it is, what it is. I think that being able to bring your cards to the table and be legit about it, and honestly have non-malicious thoughts, and you're just kind of really there to be there. I think that all that brings a different presentation, regardless of how they take it. There is no textbook on how people will take information or how they will react, or what they will do. But I think that as long as that you came in, with all your cards stacked, I think that makes a difference.
Something that's really important is you start to focus on delivering the message that we're terminating a cardiac arrest is how real this is. This is the end of somebody's life. And some of your discussion with the family is going to evolve as you watch what their reaction to you is. But throughout all of it, be compassionate, be sincere. Allow yourself to be sad. That's okay. Because somebody just died, and it was somebody's mother, somebody's son. And it's okay to acknowledge that. Do. It's healthier for you, it's healthier for them, and it'll help you get better at doing this.
I'd like to give one piece of advice to anybody who is going to do this. It is to let yourself feel sad. Because I think as we sort of go into a situation where we're going to be giving this news with, a bunch of PPE on our face and not being able to sort of like hug and hold families, where a lot of us, that's part of our normal practice. That's how we express compassion, like when it's appropriate and the families are receiving. I think the thing that's going to come through most is that people are going to feel your sense of compassion, and you have to let yourself feel the sense of compassion. I think we might be entering a time when there's going to be a lot of death, and it's going to be we're going to be tempted to not let us feel sort of the overwhelming, sad, and uncomfortable things that we are going to feel. But we have to let ourselves feel that. And I think families do better when they feel like the person who is taking care of their loved one cares, right? And either sort of tried their best or would intervene if there was something to intervene for.
The biggest thing is don't be afraid to let your own emotions show. If you've been greatly upset by a particular call yourself and you want to cry in front of the family, I don't think there's anything wrong with that. Some of us do better when we don't show our emotions, but I don't think you should be afraid to do that if that's the way you're feeling. I think that the family, knowing that you had an emotional stake in this event, actually really helps the family to know that everything was done and that you really cared when it mattered most.
So